This is episode 143 of the Rio Grande Foundation's Tipping Point, New Mexico podcast. I'm Paul Gessing, president of the Rio Grande Foundation, New Mexico's free market think tank. You can find out more about the foundation at riograndefoundation.org. You can also listen to all of the previous episodes of Tipping Point, New Mexico at tippingpointnm.com. That's tippingpointnm.com. I'm pleased to welcome a return guest, a rare return guest to Tipping Point, New Mexico. That is Dr. Deane Waldman, D-E-A-N-E, Waldman. And aside from being formerly on the board of the Rio Grande Foundation and a Albuquerque resident, Deane is also working with the Texas Public Policy Foundation in Austin on healthcare issues. So welcome to the show, Deane. And what is kind of your healthcare work at the Texas Public Policy Foundation about?
Actually, I am not working with Texas Public Policy anymore, much as I continue to strongly support their positions. And the reason is actually rather simple, and that is the Texas Public Policy Foundation very overtly focuses their efforts and wanted me to focus my efforts on Texas. And much as I really respect a whole host of things in Texas, especially since my daughter lives in California, so I can see the glaring differences.
A future Texan.
Actually, you laugh. She and her husband are literally looking at houses in Austin, Texas, this December because they can't take California anymore. Anyway.
Well, quickly, I was out in California, as Deane knows, and as listeners may know, I have three daughters of a certain age for which a certain amusement park in California has a lot of attractions. So we were recently out there over fall break, and I was, dismayed and surprised to see that the price of a gallon of gasoline in Los Angeles was approximately $2 more per gallon than the same or a similar gallon of gas here in New Mexico. And I know that's just the least of the cost differentials you get out in California relative to other places.
My California family was visiting a couple of weeks ago, and I went to, my son-in-law was sitting right directly behind me, and I went to fill up my car, and my daughter, who was sitting next to him in the second row of seats, looked over at him and said, "What's the matter?" to her husband. And he's sitting there behind me, shaking his head going, "I don't believe it." Because he's looking at the price of gas here and knowing what he pays for gas in San Jose. And it's, as you say, $1.50 to $2 more than he pays for every gallon. It's terrifying.
Well, now that you have freed yourself up, your time up from doing the day-to-day healthcare policy over in Austin, where you were working, you wrote a book on healthcare reform, Curing the Cancer in U.S. Healthcare and States Healthcare. So it's very affordable over at Amazon.com. And tell us about this new book.
Okay.
It's a paperback, so it's affordable for people to go out and purchase
there's an ebook, which is literally $3.99. The whole point of the book is the following, and it's really important. And that is, when I was chief of cardiology, everybody knew you didn't come to me with a problem unless you at least had a potential solution. A suggestion, I don't have to take it, but don't tell me you got a problem if you don't have some idea of an answer. I wrote a book a couple of years ago that basically diagnosed what the root cause of the problems were in the U.S. healthcare system, and I likened it to cancer. And so the title of the book was The Cancer in U.S. Healthcare. Well, then I realized, hey, I was violating my own rule by writing a book about a problem without giving the solution. So this book starts basically with, okay, what's the root cause of the problem, plural, that we have in healthcare in the United States. Okay, let's be clear on that. And then, given that we now know what the root cause is, what this cancer is, what is the solution? What is the cure for our healthcare system? And so the cancer, frankly, is federal control of healthcare. The solution is glaringly obvious, and it's what I call states care, which is the feds get out of healthcare entirely. There's no longer a one-size-fits-all. If California wants single payer, which my analysis suggests is a bad choice, but that's my analysis. I'm not living in California. If 39 million Californians want single payer, I say go, live and be well. If 28 million Texans want a free market-based system, I say go, live and be well. And I will advocate here in New Mexico for what I think is the right answer, which is the second half of the subtitle of the book, which is Market-Based Medicine, which basically returns control of both their money and their medical decision-making to the patient rather than having some bureaucrat make those decisions for you.
And just to be clear, Deane knows of whence he speaks. He is both a former pediatric cardiologist practicing and also an MBA. How many of those folks are out running around in the world?
There are actually more than I thought, but, in our country, there are probably a couple of thousand out of, 900,000 physicians.
Okay, that is a very small fraternity. So you understand, though, my point is you understand the workings of the human body and all the medical aspects, but you also have an eye for the business and the economic aspects.
As a matter of fact,
healthcare.
that's actually very important, and I'm glad you brought it up, which is the way I found the cure for our healthcare system was applying a medical approach. Namely, you have to first find out the cause of the patient's illness and then treat that rather than just treat the symptoms. But I used for the diagnostic tools all the stuff that I learned being the chief of cardiology, getting my MBA, doing this research in management and strategy of business. So I applied those tools to healthcare, which is how I came up with this, the evidence that the problem in healthcare is the very fact that Washington controls it.
And, I might add that even if it was discovered just in accidentally writing the book and you thought about it, your constitutional scholarship shines through here because healthcare is never mentioned a single time in the U.S. Constitution. There is no provision for the U.S. government to do anything in healthcare, and the 9th and 10th Amendments would seem to specifically prohibit the U.S. federal government from engaging in healthcare policy. So I know
that's not a maybe. If I may change
fair enough.
I mean, the 10th Amendment says, quite literally says, those things which we give to the federal government are the government's responsibility and authority. If we don't specify X, whatever X is, as an authority, as what they called a power of the federal government, then the federal government's got no business being there, and the power, and I quote now, is reserved to the states and the people respectively. And healthcare, hey, there were, 5 signatories to the Declaration of Independence who were physicians out of the 55. There were, several dozen, maybe a couple of hundred physicians who were delegates to the Constitutional Convention. It's not like they forgot about healthcare. They understood that healthcare is not the federal government's business, period. It's not in their wheelhouse.
Yeah, and there's a lot we could talk about in that regard, but I do want to talk a little bit about your book and go through some of the points. I don't think, I'm going to skip chapter 1 because I think we know healthcare is critically ill, but you can certainly bring that into the next point, which is healthcare cannot be a right. And that is where you're going to start to cause some controversy because there are people out there who believe, for whatever reason, partially because of the education system, partially due to just the natural human nature of I want, gimme, that healthcare should be a right. So why isn't healthcare a right? Why can't it be a right?
Okay, two real fundamental issues. Number one, healthcare can be expressed as one word or as two words, and they are conflated all the time. Healthcare, one word, refers to a massive system that last year the United States spent $3.6 trillion, repeat, trillion dollars on. That's the system. Health care, two words, is an intimate fiduciary relationship between a doctor and a patient. So let's be clear that when I say health care is not a right, it is health, pause, care, the relationship of a doctor and a patient cannot be the patient's right. Now, why do I say that? For two reasons. Number one, there's this little thing that founded our country. It's called freedom. And it's individual freedom, that you have the right to do what you want as long as you don't hurt other people or you don't incite to violence. Basically, you can do whatever you like within the social rules that we accept as contractual obligations. You stop at traffic lights, et cetera, et cetera. Okay, healthcare, two words, is a physician's or a nurse's or a therapist's work product. It's literally their service. So if it's the patient's right to demand and call on that service, that's called slavery. Okay, you can't get around the fact that a physician has the right to say no. If he doesn't have the right to say no, or she doesn't have the right to say no, then he or she is either a slave or an indentured servant, call it what you will, but no longer has freedom. And freedom is the highest right we have in this country. So that's why I say healthcare cannot be a right, period.
So what most people on the left, as I understand it, would say to that is nobody is going to force doctors to provide health care. We are just going to use the power of the state to, tax people enough to pay in a more or less open market, Medicare for all, whatever, so that doctors are willing participants in this system.
Okay.
And that all of this is going to be funded by taxpayers.
Okay.
You get the Canadian, you got the British, you got other models along those lines.
Okay. And here we go with two things. One, you're right. That's what, for example, Medicare for all, I think Section 102 is universal entitlement. It means you're entitled to a physician's work product. Well, excuse me, what if nobody wants to go to medical school? Then what good is that entitlement? Or if they pay physicians so poorly, which under Medicare for all, they're literally cutting physicians' reimbursement. They call it reimbursement. It's payment. They're cutting it 40%. Well, excuse me, there aren't going to be any doctors. So what good is that entitlement? And number two, more important, freedom, the foundation of this country, comes with automatically. You can't be free without being personally responsible. And if you are entitled by the federal government to something, whatever it is, that means the federal government is responsible and you are not. And I can tell you 100% of physicians will agree with this statement. If people want to be healthy, they have to take an active role. They have to be responsible for their own well-being. We merely advise them, but they're the ones who make decisions that are good or bad, that affect their bodies and their minds. And personal responsibility is a necessary commodity for a healthy population. So if you really want a healthy American population, then you have to accept that people need to accept a level of personal responsibility, which means you can't have universal entitlement.
Well, now you're just talking like a right-wing radical. Personal responsibility, those words are left by the wayside these days.
If our founding fathers were right-wing radicals, then yes, I'm a right-wing radical.
All right.
Were they?
I think some would increasingly place them in that category for sure. But we can leave that debate for another time, because I want to talk about the cure, and we can come back to any of these topics throughout this conversation, but you reference states care, which is, as I understand it, a system where you get rid of the federal bureaucracy with healthcare. You fund healthcare to the extent that it's going to be, the state's going to be involved. I mean, state itself, like California, New Mexico, New York, Texas. And that if you want a program, the state has to provide the financing. So they have to tax their own citizens for that care, not this federal situation, which is much more.
Well, the only problem with that, and I say it in the book, is the only problem with that is at the present time, states are giving a huge amount of their money, New Mexico, California, doesn't matter, to the federal government for health care. If we, the state, is going to take on health care for ourselves, then one of two things has to happen. Either they have to give us back our money,
Sure.
100% of it, not what's going on right now, which is they take our money, our tax dollars, and they give us back an average of about 75 to 80% of that, and they just keep 25% or so.
Well, there's no way they can give us back 100% because Medicare alone has a somewhat $50 trillion unfunded liability. Medicare is wallowing in red ink. They can't give it back because there's no money. It's all debt.
It's time for the American people to understand that. I mean, you referenced something very important, which is not getting any play in the press, which is the Medicare trustees themselves said that the Medicare program will be bankrupt, insolvent, unable to pay for care by 2026. That's less than 7 years from now. Medicare will go belly up. So if you're 70 years old or 65 years old, you can look forward to a program that won't exist, that will not be able to pay for your health care and certainly your hospitalization in less than 7 years. So when people say, well, Medicare for all, I say, okay, so you want to expand a system that's inherently bad. You brought up the issue of, well, they can't pay us the money they owe us. And my response is yes, but the American people have to recognize that. And in my mind, we should abolish, if you want to talk Medicare, we should abolish the Medicare program, and the federal government should give us a 5-year buyout. They could afford that, a 5-year buyout. But we're still talking taxes here, which is the Medicare tax is separate from our federal tax burden. I want one of two things, on states care. Either the state gets back its money, 100% of it, from whatever the percentage was that they got in the first place for health care, the feds, or they don't tax us at all. So they reduce our federal tax burden. Either way, the money should be in the states to decide what to do with.
Well, I couldn't agree more. And the Medicaid problem is actually the one that's more clearly delineated along state lines. And New Mexico is a perfect example of a welfare state sucking money away from other more economically successful states in order to prop up a poorly organized, a poorly functioning Medicaid system. And I think, and I'd be interested in your perspective on this, like you're very ambitious in terms of how this would be done. Do you think that starting with one program like Medicaid would be the way to go? Because I know that's been talked about, returning Medicaid to state administration, state control over the money, and ultimately state standards in terms of how they administer that program.
That would be a good thing to do, although it would be insufficient to really deal with 180 to 200 million Americans who are not in the Medicaid system. But I actually, that was initially my plan, was to try and use Texas as a pilot project to do exactly what I talk about in the book. There just wasn't a lot of enthusiasm at the state level to do what I suggest. Now, you call this ambitious, and I'd like to turn that around for a minute and say, we spend a lot of time talking, we, the American people, well, that's possible, or this is possible, or that's politically viable. I've heard a lot of people whom I respect say, hey, your ideas are right, and they will never be implemented. And I say we need to start, and we need to demand that our Congress people start by saying what's right and what's wrong. Not what have I got enough votes for, or what will the budget allow, or what's good for my party. I'm really tired of that on both sides of the aisle. I want somebody to stand up and say, the right thing for our healthcare system is this, and whatever this is, and I have the evidence to prove that this is the right thing to do for our healthcare system, and we need to now figure out how to accomplish it instead of saying, oh, well, I'll never get the votes. So am I ambitious? Yes, but I start with a basic principle of I'm a physician, I have a patient. I'm not going to simply do what I think I can get away with because I only have 2 hours in the operating room. If the patient needs 4 hours in the operating room, then damn it, I'm going to spend 4 hours in the operating room with that patient, and I don't care what the hospital administration says. That's what the patient needs, and I say the same thing has to apply to our healthcare system.
Now, really quickly, kind of within shouting distance, at least, of some of this state authority, several states have still not taken on the Obamacare expansion of Medicaid.
Yes.
Texas, I believe, is one of those states.
That's right. 17 states have not.
I would love to find somebody who has done some studies on this, because there should be a pool of information available at this point. We're talking several years.
There is. It's actually referred to in the book, Curing the Cancer in U.S. Healthcare, and you bring up a perfect demonstration model. We've got Texas that didn't implement Obamacare expansion. We have New Mexico that did implement Obamacare expansion. Or let's pick a bigger state. Let's say New York, because this is a real good demonstration. New York has the lowest uninsured rate in the country. Texas has the highest uninsured rate in the country. Okay, sounds like a bad thing. Should have expanded Medicare. What? Wait. Medicaid.
Sorry.
Wait.
It's so easy to make that mistake.
Yeah, and I even I did it. Okay, New York, or like New Mexico, did expand Medicaid. New Mexico, now 42% of the entire state is on Medicaid. 42% of our population is on Medicaid.
It's actually down from a few years ago when the economy wasn't as good. We were within shouting distance of 50%, so we've dropped a few percentage points, thankfully.
Meanwhile, so I still want to make this comparison. New York has the lowest uninsured rate. Texas has the highest uninsured rate. New York has the worst wait times to see a doctor in the country. Texas has the best wait times to see a doctor in the country. So let's stop for a minute and just say coverage, insurance coverage, is not the purpose of a healthcare system. The purpose of a healthcare system is access to care. And it turns out that the state that didn't expand Medicaid under Obamacare, the patients are getting care more timely than the patients in New York that did expand Medicaid. Well, there's got to be a lesson there. You asked, is there evidence? There's the evidence.
That's good evidence. So read the book, Curing the Cancer in U.S. Healthcare, just released recently, right?
Yeah, just 2 weeks ago.
Yeah, on Amazon.com by Dr. Deane Waldman. And there's way more to be discussed here, and I'm going to throw some concepts at you, because what you're talking about it's a philosophical change that needs to take place, because let's face it, we need people's hearts and minds to change about how they approach all of these issues. But there are other concepts in healthcare that I'd like to pick your brain on. One, we just had a conversation last week with a physician assistant, I think is what his title is. He is engaged in direct primary care.
Mm-hmm.
Now, what is your take on that?
Sure.
Is that potentially a solution to this entire problem? Or
is it a solution? It is actually part of what I call market-based medicine. If you really boil down and sort of drill down and say, well, mechanically, what's the problem with healthcare? Mechanically, the problem is a third party is the payer, and therefore a third party is the decision maker. If you go back to my grandfather's day, there was a doctor and there was a patient, and the doctor advised the patient made a decision about what he was going to do or not do with his body or his mind, and he paid the doctor. They were directly connected without a third party in between. Now, you ask me about direct primary care, which I think is absolutely the right way to go. Direct primary care simply cuts out the third party and connects the patient and the doctor directly. And that's what has to happen. And before everybody might be listening to this goes, well, okay, great, but I can't possibly afford, anything big or bad. I would point out, expensive. I would point out that last year, the average American family of four spent over $28,000 on healthcare costs. And I turn around and this is data, this is not just Deane coming in.
Well, let me just jump in here, because people don't often realize what I assume is included in that. It's not just the money that you give to your doctor. It's not just the money that's taken out of your paycheck to pay for your insurance, but it's also what your employer is putting in.
Yes.
That you never see.
And that he gets the tax advantage of instead of or she, of course, and not. I'd like to simply eliminate that tax advantage and say to the employer, "Hey, give that to the consumer as compensation. It's no skin off your nose which way you go, and meanwhile, give the tax advantage of paying for medical costs out of your HSA as a tax-deferred thing to the patient, to the consumer, not to the employer."
And let me again jump in, because you mentioned a acronym, HSA, which I think a lot of us free market folks consider one of the best developments in healthcare in recent memory. Health savings accounts, briefly just describe why they're a good thing.
They're a good thing, but they're not. And the reason that they're not is because of the federal constraints on it. You firstly have use it or lose it. Number two, you have a limit as to how much you can put in there. I mentioned this $28,000, which I keep looking at and I keep making people look at, because that's what they're spending. And I turn around and say, suppose we got rid of the federal rules on an HSA and made them, you can put in as much as you want. It becomes immortal. That is, if you want to give it to your children, if you don't use it, you want to give it to your grandchildren, whatever. Make it a family, if you don't have a family, an individual, but immortal, so that if you take that $28,000 that the average American family put in and you throw it into your own HSA, pre-tax dollars, they come off of your tax return, okay? And you just leave it in there, and if you're healthy, in 2 or 3 years, suddenly, excuse me, you got $75,000 or $100,000. Buy catastrophic insurance, high deductible catastrophic insurance for the what hits the fan, and God forbid you're in an automobile accident and you got a $100,000 hospital bill. Fine, you got catastrophic insurance. Otherwise, pay for your pediatrician, pay for your mammogram, pay for your 60-year checkup, because if you shop for your care and the doctors are getting paid directly, A, the doctors will get paid more, and B, it will cost you less than it's costing right now. Back to what you said earlier, direct primary care. Most direct primary care plans are a membership plan, which is you pay the doctor a certain amount on a monthly basis. It varies to as low as $50 a month to as high as $100 a month. If you look at the math, that's still less than anybody's copay with private insurance. So now you've got your own doctor. You chose that person. That person will see you as often as you need. If you need an appointment tomorrow, fine. They will schedule an appointment tomorrow. There's no billing. There's no coding. There's no insurance review, et cetera, et cetera. It is good for the doctor. It is good for the patient. And the only people it's bad for is the federal bureaucracy.
And just to be clear, direct primary care, folks should go back and listen to my interview with Dr. Stephen Muir, Pecos Valley Wellness last week, or a couple weeks ago, I should say. Direct primary care, you can have a family physician basically at your beck and call.
Right.
Now, if you have cancer, you need a specialist, that person probably may not be able to handle all of that.
Yes.
But that's what your true insurance policy is for.
And let's go one step further. That direct primary care doctor will say to you, I've seen the results of Dr. X or whatever system with this type of cancer. I've also seen Dr. Y with this type of cancer, and I would, in your best interest, recommend Dr. Y.
So they're a bit of a healthcare Sherpa,
It
if
is
you will.
a definite healthcare advisor.
Right.
Okay, so, and he's got no dog in this fight. He's got no axe to grind. It's not like when I was on the university faculty, it was assumed that I would refer to other people in the university. Well, what if it turns out that somebody is better in Florida or in California or whatever with my particular baby with that particular problem? Whoa, this is not okay, both by the university and by the insurance company. Insurance company's got a contract, and they want the cheapest they can get, not the best for the patient.
All right. Another question. Christian Health Share.
Sure.
This is what my lovely wife and our 3 children are on.
Yep.
We had been on a independent health, and Deane knows some of this history. I had a health savings account prior to Obamacare. Then Obamacare came in, and the president's lie about you can keep your health care policy if you want to was shown to me personally when that plan went away and the plans available were much more expensive. Then we went on to her employer's plan. It was very costly and very bare bones coverage. So now we're on, it's called MediShare.
Yep.
You can find out about it online. We're not going to describe all the ins and outs, but where do you think those kinds of things fit in? Are they just a workaround to get around Obamacare? Or
No,
is there a real potential there?
They are a real potential. I would point out that Obamacare tried, and to a real degree succeeded, in preventing any of these other association plans, which is what MediShare is one example of. I would point out, by the way, even though it is a Christian, if you will, ministry, you don't have to be Christian to be part of MediShare, which is a rather interesting sort of tweak. But is this a good thing? Absolutely. People are simply saying, we are banding together. We are creating our own insurance pool. Okay? There's no profit here involved in United Health or in Aetna or Blue Cross. There are no shareholders other than the people who are in the association, and the only profit they get is that their big medical bills are paid for by the association. So I'm all for people banding together, not under a government cookie cutter approach, and doing what they think is in their collective best interest.
All right. Well, we have about 10 minutes to go, and I want to give you the chance to talk about any other aspects of the book that we've missed. I've got plenty of other things to talk with you about, but is there any aspect of the book that you really want to share that we haven't talked about yet?
Yeah, I started it, and I want to sort of say it again to emphasize it. We, the American people, have to stop assuming that Washington is in control and there's not a damn thing we can do about it. We have to say, this is what we want. You're supposed to serve us, Now, notice I'm not talking about Democrat or Republican. I'm saying both. They are, quote, public servants, end quote, and they don't know best. We know best what's good for us as individuals. And that people need to read this book and get energized and go to their state legislators as well as their federal legislators and say, get out of my health care. And if we do that, we can actually accomplish what is in that book. And if we just sit back and say, and I told you, a lot of people whom I respect very highly think that I'm just beating my head against a brick wall, that this can't be done. The power of Washington is too great. The power of the special interests is too great. And I turn around and say, I'm sorry, the people have the power if we just damn well use it.
All right. Well, like I said, we're just working in the state of Texas. And if there's a state inclined to giving Washington the middle finger and
yes,
going off on their own, whether it's as a part of the union or they reserve the right to tell Washington to get lost, but put yourself up as, we won't talk about kings or you're the new healthcare advisor to the governor of Texas or the Lone Star State of Texas, whatever comes our way down the road. Give us how you would like healthcare to work
right
in Texas. Now, before we move to this point, you explicitly stated early on that if California wanted single payer, we're assuming California is a pretty left-wing state, they might be the kind of state to adopt a single payer system. As long as they do that self-funding and take care of that themselves, that's fine. But obviously we know that's not the Deane Waldman plan moving forward. What would you do at the state level, given the reality that you're looking for? How would it happen?
While I would like this to happen in toto, my plan for Texas was to say, okay, we'll be a pilot project. Now, Texas, and I'll explain this in some detail, Texas has 4.1 or so million people on Medicaid. Now that's
double the population of New Mexico.
Double the population of New Mexico is just on Medicaid, and they didn't expand Medicaid. So that's just 4 million people, Texans, on Medicaid. I suggest that we say Texas says to the federal government, hey, we'll be your demonstration project. We'll be your pilot project. Go away, leave us alone. We'll take care of Medicaid with a market-based system. And I've already had people say to me in Texas, well, the Medicaid population doesn't really understand these principles, and, they won't know how to shop for care. And I go, excuse me, if you're making $20,000 a year, you're probably the best and most efficient shopper on the planet Earth because you're surviving on such a small amount of money. So I don't agree with this. Well, they don't know how to shop for care. They go to their primary doctor. They get advice on what is good, what's bad, by a doctor who cares about them. Anyway.
Well, real quickly on that point, my sister-in-law, who does make probably about $20,000 a year right here in Albuquerque, got hammered with taxes from Obamacare prior to Trump having pulled back the mandate on individuals with purchasing health insurance. She, because she lives close to the line, decided to abandon that despite my wife's, myself, our advice saying, you have to do this under the law. She had to pay significant fees thanks to Obamacare, who, Obama supposedly, the champion of the poor, all this kind of stuff, and yet he's laying heavy taxes on people earning $20,000 a year.
Every politician, these politicians that talk about, well, we're going to tax the rich and pay for healthcare that way, every politician on the planet knows that the money, it's the Willie Sutton rule. You go where the money is. Well, the fact is the money is not in Bill Gates or in Warren Buffett. It's in the middle class. And so if you are going to demand taxes to do anything, you're going to have to raise the. You'll notice Elizabeth Warren, by the way, was asked, I think, a total in the debate of 6 times.
Yep.
Would her plans raise taxes on the middle class? And not once did she respond yes or no to that question. But to finish off, you asked me what I would do. I want Texas to take its Medicaid population, say we're going to do a pilot project, we're going to make a market-based system in the poorest and least educated population, and potentially the sickest population, namely Medicaid, and we are going to have a safety net for the people with high pre-existing conditions and high expense stuff, which they had before Obamacare destroyed them, and leave us alone for 5 years, and we'll prove to you that a market-based system can work in anybody. You asked me what I would like to do. That's what I would like to do, and Texas is the place to do it.
So that's obviously one significant aspect. That's Medicaid.
Yes. But think about it. If it works in Medicaid, why wouldn't it work in everywhere else? But I reiterate, it is not my place, and it's not Washington's place to tell 39 million Californians what they should do with their health care. They should decide for themselves.
Okay, well, you've got Medicaid, you've got Medicare. We kind of already discussed that. The federal government's tentacles go further and much deeper. Federal Food and Drug Administration. Now, I know that's kind of a side issue in some ways, but it's at the core of our medical issues. I know President Trump, with the right to try, at least attacked one area. So why don't you talk about the drugs and FDA and that approval process, and how, obviously, I don't know, maybe you say Texas should come up with its own. I can't imagine that. That would be a very ambitious proposal, but go ahead.
Well, you laugh all you want. There was someone who I can't discuss on air who actually came to me and said, he happens to be a billionaire, came to me and said, if you can come up with a plan for a TDA,
Texas Department,
a Texas Drug Administration, I will fund it. Literally, that's what he said. The trouble is, federal law prevents a state from doing that. Now, much as I want people to read my book, Curing the Cancer in U.S. Healthcare, States Care, and Market-Based Medicine, much as I want that, there is another book that I urge everybody to read. It's called Death by Regulation. It's by a PhD doctor, Mary Ruwart, R-U-W-A-R-T. And basically what she shows with all the evidence is how the FDA prevents competition, maintains monopolies of a number of different companies and drugs, and actually the cost of getting through the FDA, which last time I checked was $2.7 billion to get a drug after you spend all the money on research and development, Merck or Pfizer or whoever does all the research, because they want to make a profit, as they should. If you have something good and important, you should make a profit on it if it's new and you spent the money. But let me finish
go ahead.
The thought. Where does that $2.7 billion go? The answer is they have to charge the American public that money, which means that that drug has to be very expensive, because the money the cost indirectly was generated by the FDA.
Yeah, making that actual pill, the individual pill, is pennies.
That's exactly right.
So when you get these foreign countries with their price controls, the drug company has a decision to make. Do we sell for still what is probably a decent profit to them, and then have the U.S. customers, unfortunately, support that
That's
situation.
Exactly. That's what's going on right now.
It would be interesting if the pharmaceutical companies said, forget about it, to Mexico or whatever countries have the price controls, and just export it to the United States, because it would illustrate what they deal with.
But if we just leave it the way it is, what's going to happen is there aren't going to be new drugs.
Right. You got it. It's
price controls of anything results in low quality and shortages. I mean, if people learn nothing from the history of the USSR, and I would point out most people don't seem to remember what the second S in USSR, a failed system, a dramatically failed system. It's the Union of Soviet Socialist Republics. And when Democrat candidates are talking about bringing back socialism to this country or socialist principles, I go, excuse me, we've got ample evidence to show how that fails, not just in healthcare, but in everything else. And you want to do it here? I'm sorry, no.
Well, you are of a certain age, and even I'm of a certain age, where we remember the Soviet Union. We've seen the television footage of people standing in the lines to get groceries and stuff. There are unfortunately a predominantly left-wing generation of people, it seems like, that comes after us. Not that Elizabeth Warren and Bernie Sanders shouldn't know a heck of a lot better. Those people, it's unbelievable. But the younger people haven't seen communism's full horrors or seen the glimpses of them that at least you and I have seen. Unless you've been to the Soviet Union, I didn't know about it.
No, you raise
so go last point.
I've never seen smallpox. That doesn't mean I can't learn from the experience of medical practitioners of 100 years ago and what smallpox looks like and how it kills people and why we should vaccinate. So my point is, our younger generation should be learning from the experiences of the 20th century. We don't have to go back to the 15th.
All right. Thank you for listening to this week's podcast. Make sure to get the latest edition of Tipping Point New Mexico by subscribing to Apple Podcasts, Stitcher, and Spotify. You can post or comment on this and other episodes on Facebook and Twitter, and tell Google Home to play Tipping Point New Mexico. Thanks to Path 3 Marketing for producing this show.